What if the vitamin you take every morning, the one you bought to stay healthy, is quietly making you sicker? This isn't clickbait. It's reality for millions of older adults. After 65, your body changes. Your liver slows down, your kidneys filter less efficiently, and your nerves become more fragile. But most vitamin labels don't change. Most supplement ads don't mention this shift. They just say, take this for energy, or boost your immunity. And we trust them. But that trust could be putting your brain, your heart, and your entire body at risk. What if the real reason for your fatigue, your tingling feet, or your brain fog isn't aging? It's your vitamins. You're not alone. According to the Journal of Medical Aging, more than 60% of people over 65 take at least one supplement that may be harmful at their age. Even worse, many seniors stack vitamins. A multivitamin in the morning, a nerve support formula at lunch, a bone health pill at night, all with overlapping ingredients, all with doses designed for younger bodies. Bold labels, big promises, but dangerous consequences. Here's a truth most people never hear. After 65, the wrong vitamins can age you faster than time itself. So in this video, we'll uncover the 4 worst vitamins you should never take after 65, and the 4 you must start daily if you want to live stronger, longer, and safer. The difference could be life-changing. One of the dangerous vitamins we'll expose has been linked to brain shrinkage. Another is quietly causing artery calcification, setting the stage for strokes. And the worst part? These supplements are often labeled for seniors. Your symptoms may not be aging. They might be avoidable. We'll also reveal the 4 essential vitamins your body actually needs more of with age to protect your brain, repair your nerves, balance your muscles, and fuel your heart. These aren't obscure supplements. They're supported by science. They're recommended by doctors. And best of all, they work naturally with your aging body. So get ready. This could be the most important 20 minutes you spend on your health all year, because by the end of this video, you'll know exactly what to stop and what to start to protect your future. Let's begin. Vitamin A sounds like a hero. It supports vision, the immune system, and skin health, right? That's true, but only when it's in the right form and the right amount. After 65, vitamin A, specifically in its retinol form, can quietly become toxic. Here's why. Vitamin A is fat-soluble, which means your body stores it in your liver and fatty tissues. Unlike water-soluble vitamins that flush out easily, fat-soluble ones build up over time. And the older you get, the slower your liver works, and the more easily those buildups happen. If you're taking a daily multivitamin, a liver supplement, or a bone support formula, you might be stacking retinol without even knowing it. Your skin might feel dry. Your joints ache. Your vision gets blurry. You might assume it's just normal aging, but it might actually be chronic vitamin A toxicity, and it builds silently. Many seniors are overdosing on vitamin A without ever going near the overdose line. One study in the European Journal of Clinical Nutrition found that seniors who consumed high doses of vitamin A had a 25% higher risk of atrial fibrillation, a dangerous heart rhythm disorder that can lead to stroke. That's not a small number. That's life-threatening. So how much is too much? For seniors, anything over 700 micrograms per day for women or 900 micrograms per day for men from supplements is considered potentially risky. If you're also eating liver or taking cod liver oil, you're likely way over the safe zone. Here's the irony. You can get all the vitamin A you need safely without taking a single pill. Beta-carotene found in sweet potatoes, carrots, spinach, and eggs is a precursor to vitamin A. Your body only converts it when it's needed, so there's virtually no risk of overdose. This natural form of A is safe, smart, and balanced. Exactly what your aging body prefers. So check your labels. If your multivitamin includes retinol or retinol palmitate, it might be time for a change. Your liver and your heart will thank you. Iron is essential. That's what we've been told for decades. It builds red blood cells, carries oxygen, and prevents fatigue. So it's no surprise that many multivitamins for seniors still include iron, sometimes in high doses. But here's the problem. After 65, your body's relationship with iron changes dramatically. Unlike younger adults, seniors don't lose much iron through menstruation, injury, or growth spurts, and yet many continue to take iron just in case. That just in case may be doing more harm than good. Iron is not like vitamin C. It doesn't flush out easily. Instead, excess iron is stored, mostly in your liver, heart, and pancreas. Over time, that storage turns toxic. The more iron you store, the more oxidative stress builds up, damaging cells, aging tissues, and overwhelming your organs. This is called iron overload, and it's more common in seniors than most people realize. It accelerates aging, it increases inflammation, and it's been linked to serious conditions, Alzheimer's, liver disease, heart failure, and certain cancers. What makes it worse is how silent it is. The early symptoms of iron overload, fatigue, joint pain, brain fog, sound familiar? They're often dismissed as normal aging, when in reality, they might be your body begging you to stop the iron. Most seniors don't need supplemental iron, especially men and postmenopausal women. Unless you've been diagnosed with anemia or have experienced blood loss, you're likely getting enough iron from food, and modern diets are full of it. Red meat, beans, fortified cereals, spinach. Add a supplement to that, and you tip the balance into toxicity. One hidden danger? Many senior multivitamins still include iron, even when most seniors don't need it. That's why it's critical to check your supplement labels. If you see ferrous sulfate or iron fumarate, and you haven't been told to take it by a doctor, it's time to reconsider. A better approach? Ask your doctor for a serum ferritin and transfer and saturation test. These blood tests show how much iron is stored in your body. If the levels are high, your doctor may recommend stopping supplements, reducing red meat, or even donating blood to remove excess iron. And here's a surprising fact. In one large study, people with slightly lower iron levels lived longer and had less chronic disease than those with high normal or elevated levels. So when it comes to iron after 65, it's not about more is better. It's about balance and safety. Calcium is supposed to protect your bones, right? That's what we've been told. In commercials, doctors' offices, and nearly every bone health brochure. And yes, calcium is important, but there's a hidden danger few seniors are ever warned about. When taken incorrectly, calcium can harden your arteries instead of your bones. After age 65, your body doesn't handle calcium the same way it used to. Your bones stop absorbing it as efficiently, your kidneys don't filter it as well, and your arteries, if you're not careful, become its next target. Here's how it happens. Most people take calcium as a standalone supplement, often in large doses, but calcium needs help to get to your bones. Specifically, it needs vitamin D3 to absorb properly and vitamin K2 to direct it into bone tissue. Without those cofactors, calcium goes rogue. Instead of strengthening bones, it ends up in soft tissues, your joints, your kidneys, and worst of all, your arteries. This leads to artery calcification, a condition where calcium forms deposits inside blood vessels. It reduces flexibility, increases blood pressure, and raises the risk of heart attack and stroke. And most people have no idea it's happening. In fact, many seniors take 500 to 1,000 milligrams of calcium daily, thinking they're helping their bones when in reality, they're creating a silent threat to their heart. One large study in the British Medical Journal found that people who took calcium supplements without vitamin K2 had a higher risk of cardiovascular events, even if their bone density improved. It's not that calcium is the enemy, it's how and when you take it. Think of calcium like concrete. If it's guided, it strengthens the right structure. If left uncontrolled, it clogs the pipes. So what's a smart way to support bone health after 65? First, get most of your calcium from food. Your body absorbs calcium from food more gradually and safely. Great sources include leafy greens, sardines with bones, yogurt, almonds, chia seeds. Second, if you must take a supplement, make sure it's combined with vitamin D3 and K2. This trio helps absorb calcium properly and shuttle it into your bones, not your arteries. And third, move. Your bones need pressure and movement to retain strength. Calcium without activity is like cement in a mold that's never shaken. It just sits and hardens where it shouldn't. Final tip, avoid taking calcium with high doses of iron or zinc. They compete for absorption, and if you take acid blockers for heartburn, be cautious. They can block calcium uptake, leaving you with side effects but none of the benefit. Bottom line, calcium matters. But after 65, it's no longer about how much, it's about how wisely you use it. Vitamin B6 has a great reputation. It's often praised for boosting energy, supporting brain health, and even reducing symptoms of PMS and depression. So it's no wonder that many multivitamins, nerve supplements, and energy boosters contain high doses of B6. Some even advertise it as brain fuel or nerve support. But after age 65, B6 can become a hidden threat, especially when taken in large doses over long periods. Here's why. Unlike most water-soluble vitamins, B6 has a unique ability to accumulate in nerve tissue. Normally, we assume that water-soluble vitamins get flushed out if they're too much. But B6 is different. In high doses, B6 becomes neurotoxic, damaging your sensory nerves and mimicking the very symptoms you're trying to treat. Tingling feet, numbness in the hands, burning sensations, loss of balance, muscle weakness. Sound familiar? These are all signs of B6 toxicity, but they're often misdiagnosed as peripheral neuropathy, diabetic nerve damage, just getting old. The truth is, you may be overdosing daily without realizing it. The recommended daily allowance, RDA, for people over 50 is 1.5 milligrams for women, 1.7 milligrams for men, but many over-the-counter supplements contain 10 to 100 milligrams per serving, sometimes even more. And if you're taking multiple products like multivitamins, energy pills, and brain formulas, you're stacking B6 all day long. Over time, that overload adds up. Studies have shown that even 50 milligrams per day, taken consistently, can lead to nerve damage, especially in older adults whose bodies process nutrients more slowly. Here's the scary part. Once nerve damage begins, recovery can take months or might never fully happen. This is especially dangerous if you already have risk factors like diabetes, thyroid imbalance, kidney issues, or are on medications that affect nerve sensitivity. So how do you stay safe? First, check your labels. If your supplements contain more than 5 to 10 milligrams of B6 per serving, especially without doctor supervision, it's time to reconsider. Second, don't stack. Avoid taking multiple products that contain B6 unless you've been tested and prescribed a therapeutic dose. Third, get your B6 from food instead of pills whenever possible. Great sources include bananas, eggs, tuna chickpeas, poultry, fortified cereals. When consumed through whole foods, B6 is absorbed gradually and safely, without overloading the nerves. And finally, if you suspect symptoms like numbness or burning, Talk to your doctor and request a B6 blood test. It's quick, simple, and could save you months of nerve pain. Bottom line, vitamin B6 is important, but more is not better. After 65, more could mean lasting nerve damage, fatigue, muscle cramps, poor sleep, anxiety, irregular heartbeat. These are all common complaints among seniors. And while they're often blamed on aging, many of them trace back to one overlooked mineral, magnesium. Magnesium is involved in over 300 enzyme systems in the body. It supports nerve and muscle function, maintains heart rhythm, and helps regulate blood pressure and blood sugar. And yet most people, especially those over 65, are deficient. Why? Aging bodies don't absorb magnesium as well. The kidneys excrete more of it. And to make matters worse, many common medications taken by seniors, like diuretics, acid blockers, and blood pressure pills, flush magnesium out even faster. You might be eating well, but still slowly becoming magnesium deficient without even knowing it. Early signs of deficiency are subtle: twitching, trouble sleeping, cramping, fatigue that doesn't improve with rest. Over time, more serious consequences appear: insulin resistance, weakened bones, heart arrhythmias, cognitive decline. Magnesium deficiency has even been linked to higher risks of dementia and type 2 diabetes in older adults. So what can you do? First, recognize that you likely can't get enough magnesium from food alone, not because of poor diet, but because modern soil is depleted. Even spinach and almonds contain less magnesium than they did 50 years ago. Second, understand that not all magnesium supplements are equal. Magnesium oxide, the most common, is poorly absorbed and can cause digestive issues. Better options include magnesium glycinate, calming, gentle on the stomach; magnesium citrate, well absorbed, helps with bowel regularity; magnesium malate, good for energy and muscle pain. Avoid magnesium carbonate or sulfate unless medically prescribed. Start with 250 to 400 milligrams per day, depending on your needs. And always take it with food for better absorption. Also note, magnesium works with other nutrients. You need enough vitamin D for proper magnesium utilization. Low magnesium can even make your vitamin D supplements less effective. That's why magnesium should be seen not just as a nice-to-have, but as a foundational part of healthy aging. And it's not just about supplements. Adding more magnesium-rich foods helps too. Leafy greens, avocados, almonds, dark chocolate, black beans, pumpkin seeds. Finally, if you're unsure about your levels, ask your doctor for a magnesium RBC test. It's more accurate than the standard serum magnesium test. Bottom line, if you're dealing with fatigue, cramps, or poor sleep after 65, the problem might not be age. It might be magnesium. Vitamin D3 is often labeled as the bone vitamin, but for seniors, it's much more than that. After 65, your body's ability to produce vitamin D from sunlight drops by more than 50%. And as levels decline, so does your protection against illness, infection, and inflammation. That's because vitamin D3 acts more like a hormone than a vitamin. It plays a critical role in regulating your immune system, maintaining muscle strength, supporting mood, and protecting brain function. So when levels are low, you don't just risk weak bones. You risk weakened immunity, depression, chronic fatigue, and even cognitive decline. The silent truth? Most seniors are deficient in D3, even those who live in sunny climates. Why? Because the skin loses its ability to convert UV rays into D3 efficiently. And many seniors spend more time indoors, wear protective clothing, or use sunscreen, all of which block D3 synthesis. Add to that age-related changes in kidney function and digestion, and even a healthy diet often isn't enough to meet your body's needs. In fact, studies show that up to 70% of adults over 65 are deficient in vitamin D3. So what happens when you don't get enough? Common symptoms include low energy, muscle weakness, frequent colds, sadness or mood swings, brain fog, poor balance. And more seriously, low D3 levels are linked to higher risk of falls and fractures, autoimmune disorders, type 2 diabetes, Alzheimer's and dementia, respiratory infections. In a major review published in the British Medical Journal, seniors with adequate D3 levels had 50% lower risk of respiratory infections, 30% lower risk of death from all causes. D3 isn't just about bone density, it's about staying alive, upright, and alert. So how much do you need? For most seniors, 1,000 to 2,000 IU per day is a safe and effective range. Some people may need more, especially if blood levels are low. But don't guess. Get tested. The best form is vitamin D3, cholecalciferol, not D2. D3 is more bioavailable, more effective, and closer to what your skin naturally makes from sunlight. Take it with food, preferably something with fat, for better absorption. Also note, magnesium and K2 work with D3. Without magnesium, you won't activate D3 properly. Without K2, calcium may go to the wrong places. That's why these three are often called the bone and immune trio. If you're taking D3 alone, you're only getting part of the benefit. Bottom line, vitamin D3 is your silent guardian. It strengthens not just your skeleton, but your system. Don't ignore it. Vitamin B12 isn't just another nutrient. It's essential for your brain, your nerves, and your legs. As you age, your ability to absorb B12 from food drops sharply. That's because the stomach produces less acid, which is needed to release B12 from protein-rich foods like meat, eggs, and dairy. Add to that common medications like antacids or metformin, and it gets even worse. You may be eating all the right things and still slipping into a slow, dangerous deficiency. The worst part? B12 deficiency often mimics normal aging until the damage is done. Here are the early warning signs: fatigue, poor memory, tingling in hands or feet, trouble walking or balancing, pale or yellowish skin. Sound familiar? Many seniors assume it's arthritis or just being tired, but often it's a nervous system crying out for help. Without enough B12, your nerves lose their protective coating, and signals between your brain, spine, and muscles start to break down. Over time, this leads to weak legs, unsteady walking, brain fog, depression, and even misdiagnosed dementia. In seniors, low B12 is one of the most overlooked but reversible causes of cognitive decline. So how do you fix it? First, don't rely on food alone. Even if you eat eggs, fish, or liver regularly, if your stomach acid is low, you won't absorb enough. Second, choose the right form of B12, methylcobalamin, active, well-absorbed cyanocobalamin, more stable, often found in standard supplements. Both are good, but methylcobalamin may work better for people with certain genetic variations or nerve damage. Next, pick the best delivery method: sublingual tablets under the tongue, sprays, lozenges, or, if severely deficient, weekly injections. The ideal daily dose for most seniors is 500 to 1,000 micrograms per day. It's water-soluble, so excess is excreted, but always talk to your doctor before going above that. Also important, B12 works with folate and B6. They form a nerve and blood trio. If you're taking one, make sure you're not deficient in the others. And finally, get tested. Ask your doctor for a serum B12 and MMA, methylmalonic acid test. The combination gives a more accurate picture of your true B12 status. Bottom line, if you're dealing with weakness, imbalance, memory fog, or low mood after 65, don't assume it's just aging. Check your B12. It might be the one nutrient holding everything together. You've probably heard that omega-3 is good for your heart, but did you know it also protects your brain joints, eyes, and even your lifespan? After 65, your body becomes more vulnerable to chronic inflammation, a hidden process that slowly damages your tissues, clogs your arteries, and accelerates aging. Omega-3 fatty acids, especially EPA and DHA, are powerful inflammation fighters. They're not just nutrients, they're cellular protectors. But here's the problem. More than 68% of adults over 60 are deficient in omega-3s. Why? Because most people don't eat enough cold water fatty fish like salmon, sardines, or mackerel. And even those who do may not get the therapeutic dose needed to protect aging tissues. The result? You may be aging faster than necessary, simply because of what's missing from your plate. Low omega-3 levels have been linked to memory loss, dry eyes, joint stiffness, fatigue, depression, and even sudden cardiac death. In contrast, high omega-3 levels are associated with better heart rhythm, sharper brain function, healthier mood, smoother joints, longer lifespan. In one large study, seniors with higher EPA and DHA levels had a 36% lower risk of death from all causes. That's not just heart protection, that's life extension. So how much do you need? Experts recommend at least 1,000 milligrams per day of combined EPA plus DHA for older adults. If you have cardiovascular disease or inflammation, you may need up to 2,000 milligrams per day under medical guidance. The best sources, salmon, sardines, mackerel. And for plant-based options, algae-based DHA supplements. If you choose a fish oil supplement, look for triglyceride form, better absorbed. Third-party tested for heavy metals, at least 500 milligrams of EPA plus DHA per capsule. Avoid cheap fish oils with low concentrations or unclear sourcing. Omega-3 is not a trend. It's a missing puzzle piece in senior health, and every day without it is a lost opportunity. Also, take your omega-3 with food, ideally something with fat, for better absorption. And if you're on blood thinners, always consult your doctor first. Bottom line? After 65, omega-3 isn't optional. It's your defense against inflammation, aging, and silent disease. Don't overlook it. If you've made it to this point, one thing should be clear. Not all vitamins are helpful after 65. Some can protect your brain, your heart, and your independence. Others, when taken the wrong way, can quietly harm the very systems you're trying to protect. The key isn't to take more, it's to take smarter. Know what your body truly needs. Understand which forms are safe and which ones to avoid. Ask questions, check your labels, get tested, because every pill you swallow should be a step towards strength, not risk. After 65, every choice counts more than ever, including what you put in your body. So if you learn something new today, don't keep it to yourself. Send this video to someone you care about, a parent, a friend, a neighbor. Let's help each other age with clarity, strength, and confidence. And if you'd like more tips like these, grounded in science, designed for seniors, make sure to subscribe to Senior Health and You. Hit the bell, and we'll walk this journey of better aging together. Thank you for watching.